What up, y'all? Welcome to another episode of Ask Kevin Yee. Today I have my friend Lien. We went to pharmacy school together. Cool fact about Lien, she was actually, before she was a pharmacist, she was actually a dental hygienist.
Yes.
So today we're going to talk about why she went from dental hygiene to the mother pharmacy. Okay? So first of all, how did you get into dental hygiene?
I always knew I wanted to do something in the medical field. So to have a backup plan just in case pharmacy doesn't work out, I decided to do dental hygiene because I had a friend who actually also did dental hygiene and she made pretty decent money. You know?
How much do they roughly make?
I think back then, which is like, what, 5-6 years ago, it was like 40, if you specialize like in pediatric, the kids, I think it was like $38 to $41 an hour.
What?
Yeah. So which
Holy shit.
Yeah, which is pretty good. You
Yeah.
know, and they don't, you know, a lot of places they don't work on weekends. It's like 8 to 5 shift, you know,
Yeah.
so it's like nice. So I was like, oh, why not, you know? And
Yeah.
I was like, I don't think I would mind working in people's teeth all day, just cleaning, you know, teeth, you know? So I was like, why not? Let's just, because it's only like, I think you can do like an associate's degree or a bachelor's degree, depending on, you know, what you want to do, but it's still the same thing. So I went and got a bachelor's degree in dental hygiene, and I actually had a dual major, so dental hygiene and healthcare management. So I had,
Oh, shoot.
yeah, so I
Freaking
had two
hustling,
bachelor's
huh?
degree, yeah,
Yeah.
at the same time, yeah. So that's how I kind of got into it, because my friend kind of did it, and then she told me, you know, like how much they made, and I was like, oh, why not? So
Yeah.
that's what I did. So when I did dental hygiene, I took all the prereqs, and then the program itself, I think, was only 2 years.
Oh, dude, that's really short. Like,
Yeah.
is it like straight from high school or like after?
No, you have to like take the prereqs. I think it's like, you know, all the sciences, the math, one English, you know, all the regular prereqs, except for like a few science courses, I believe. Yeah,
Yeah.
it's been so long, but yeah, you can't just go straight into, you know, dental
Okay.
hygiene from high school.
Okay.
That's not how it works.
So how long did it take you like from high school to go into the...
So since I did dental hygiene and I did healthcare management, I think it was a total of maybe 5 years. I think maybe.
Oh, wow. Okay.
5, yeah, because it's like a dual major. I think you have to take like only a few more classes to get the dual major.
Okay.
Yeah, so I think about 5.5 years maybe.
So you did dental hygiene and stuff. So how did like pharmacy fit into all this? Like when did you decide to do pharmacy and whatnot?
Well, you know, I've always been interested in pharmacy because in high school, actually, I started working at an independent pharmacy since like 9th grade.
Yeah.
So, you know, it was like independent pharmacy. It was like a lot different from, you know, like regular retail.
Yeah.
So I was really interested because like, oh wow, the pharmacists don't do nothing, you know, because we used to just like, yeah, like back then they just like stand around, like it was kind of like a closed door format. So,
Oh, okay.
yeah, so it was like really nice. Like, oh my God, I wouldn't mind getting paid, you know, that much and just standing around and just, you know, it was like nice. So that kind of like drive me to like, oh, maybe I should do pharmacy, you know, after working in dental hygiene, just being in clinics, you know, seeing all these patients with like disgusting mouth and.
Did you ever have to deal with like really bad breath or anything like that?
Yes, it's horrible. When you clean their teeth, I have to like double my mask up sometimes.
What?
And I still can smell it.
Is
like,
it because people don't floss or like?
they don't floss, they don't go to the dentist every 6 months, they
Yeah.
don't brush maybe twice a day,
Okay.
you know, they don't use Listerine. There could be lots of reasons.
Yeah.
But yeah, after looking at, you know, many of, you know, disgusting mouth, I was like, no, this is not for me, you know. Like it was hard, you know, for my back, for my hands, you know, and my eyes, you know, because you have to
Your
like
eyes?
yeah, because you have to kind of like be up, you know, kind of look at your teeth. Their teeth are like so small, so you have to kind of like, so I have to buy like these loupes, like a magnifying glasses to help me, you know, look in their mouth.
Yeah.
So it's like I don't have to strain my eyes to look. Yeah. So after, you know, all that, I was like, no, you know, dental hygiene is not for me. I'm just gonna go back and do pharmacy.
People that do dental hygiene, do they get arthritis or any other?
Yeah,
type
carpal
of-
tunnel is
Okay.
something that's pretty common because, you know, you have to constantly, you know, clean the calculus, so you have to use the same hand motion over and over and over again. So yes, I think carpal tunnel is pretty common. So basically, while I was in the dental hygiene program, I had a friend who was also working at the independent pharmacy with me. She applied to pharmacy school, and I was like, hey, why not? You know, so she applied to Worcester back then, MCP back then. So I was like, oh, why not try it? You know, while I was in the dental hygiene program, it's like my last year, I believe.
Yeah.
So I applied,
Yeah.
and you know, I went to the interview and everything, and I got in. You know, so I
Yeah.
just finished out my dental hygiene degree, and I never practiced. I got my license, I took my clinicals, everything. You know,
Yeah.
I was like a registered dental hygienist. And,
Yeah.
I just went to pharmacy school right when I
Dang, that's
So I
crazy.
graduated. I walked. I took my got my diploma, did everything, and I just didn't do anything with the degree.
Did you do you have any regrets? Like, do you ever wish that you practiced a little bit before going to pharm school?
Not really.
Yeah.
Like I just knew that wasn't for me. Just being in clinicals, I was like, no, it's just not something that I'm interested in. You know, like if I would have just stuck with dental hygiene, I think I would want to further my career. I wouldn't just want to stick with dental hygiene. I'll probably do like dental school after that if I was really interested in it. You know? But I need like pharmacy is for me because I think pharmacists like the job is not as, you know, like you don't have to, you still see customers and stuff like that, but you're not like in somebody's mouth all day, you know, like you don't have to touch, you know, anything.
Sometimes, Lynn, you gotta deal with the bad breath too in the pharmacy, man.
Yeah, that's true, but at least you're not like all up in it, you know, you like can stand away a little bit.
That's true.
Yeah, so like I just like thought, you know, medicine, just, you deal with customers, but you're basically working with medications all day, you know, so I like that like one-on-one, like customer, you know, interaction, but I just don't want to be in somebody's mouth all day.
How was your initial thoughts from pharmacy different from when you actually practiced pharmacy? Because earlier you were talking about, I just thought they stood around all day and stuff like that.
Yeah, well, when I was working at the independent pharmacy, it was really nice because the pharmacists, like, I felt like they didn't really do anything and they were getting paid all this money. But, you know, after graduating and after working in a retail setting, it's totally different. You know, from independent to retail, it's like, even though they're both like community pharmacies, but it's really different, you know. Yeah. Independent is like more laid back. It's not about metrics, not about numbers. You know, you don't have to worry about, oh my God, this is going to turn orange in 5 minutes, or oh no, there's 10 phone calls on the line and doctor's call and everything like that. You know, like it's so much nicer. So after graduating, actually working in the pharmacy, I was kind of like, wow, you know, this is not what I signed up for. You know, I thought it was going to be this nice, you know, like laid back, nobody yelling at me, you know, nobody complaining, nobody cussing at me because I'm not giving them their, you know, their narcotics. So yeah, it's totally different. And
I don't know. I'm blanking out right now.
I see.
Anyways, guys, if you guys got questions for me, you can send them to subscribers@refugeehustle.com. Otherwise, you can hashtag #AskKevinYee on Instagram, or you can leave a comment below. But I just want to thank my friend Lynn over here for answering all my questions. And guys, I'll see you next time. Peace.
Once you finish, you can pay off your loans in like 2-3 years, no problem. You can save a bunch of money, buy my nice clothes, nice shoes, nice purses. Well, when you get out and you actually do get a job, I mean, yes, you're very excited, but